Eyelid Xanthoma. Eyelid xanthoma are a soft, yellowish papule or plaque that occurs in the medial region of the eye, usually in the left or right eye. It is characterized by a semi-solid, yellowish deposit, which often occurs in medial aspects of both eyes. Xanthoms occur in a variety of shapes, sizes, shapes and colors, but are mostly semi-solid, semi-transparent and often yellow, with a few exceptions. Eyelid xanthomas are a benign disease that has never led to serious consequences, but is cosmetically troublesome, and most patients are dissatisfied with their images and seek medical advice for their removal. At Xanthel we get clients from around the globe, getting the treatment to remove these plaques and stop them regrowing back. There is usually no obvious clinical diagnosis, and there is no need to make any assumptions about the cause, such as cholesterol deposits that accumulate under the skin or the presence of ulcerative colitis. It is possible that Xanthelasma is an indication of high blood lipid levels, and if it has a high risk of ischemic heart disease, may be associated with an early death. Small studies suggest that even normal cholesterol levels can increase the risk of heart attack, stroke or even death from Xanthelasma. About half of all patients with Xanthos have elevated lipid levels, which are often associated and inherited. Eyelid Xanthomas. The yellowish plaques that form on the outside of the skin, usually in the upper left corner, are a thick layer of white or yellow-brown deposits. Deposits vary from soft, hard or calcareous, although variability is usually due to the chronicity of these plagues. The lesions are symmetrically distributed and can be up to a few millimeters thick. However, in the case of large lesions, direct closure can be difficult in surgery and may result in contractions, ectropions and eyelid deformities. Contraction of the eyelids can occur in various ways, such as a result of a single or multiple lesions, or in the presence or absence of other lesions. In some cases, eyelids with contractions may also occur when using topical corticosteroids and/or anti-inflammatory drugs. As well as eyelid xanthomas, xanthoma can appear on other parts of the body as well. Flat fatty deposits associated with tendons are quite common, particularly in the elderly. Skin transplantation can be performed if the defect is large after removal of Xanthelasma, but it is not recommended because grafted skin on movable tissue can be easily wrinkle-free. They are tiny to large, up to 3 inches or more, and usually soft, pale yellow or reddish. There are different types depending on where they are, the cause and how they look, but they all have different edges and range from a tiny, 0.5 to 1-2 inches, to a larger, 3 inches and more. Your health and eyelid xanthomas. These lesions typically occur within 40 to 60 years and are relatively common due to the modern diet, but can also occur in people with other types of eye diseases such as glaucoma, macular degeneration and glioblastoma. These lesions are caused by the accumulation of lipids in the upper eyelid, under the eye, or on the left or right side. These lesions have been associated with hypothyroidism, cirrhosis and nephrotic syndrome. About 50% of patients with Xanthelasma have abnormal cholesterol and triglyceride levels. The fat deposits in Xanthelasmas consist of foaming histiocytes containing lipids such as cholesterol, triglycerides, lipoproteins, fatty acids and liposomes, and proteins. These cells are also found in the liver, pancreas, kidneys and other organs of the body, such as the lungs, liver and kidneys. Eyelid xanthoma forms in the upper eyelid and can be observed anywhere on the palpable area, but the most common site for yellow plaques is the intermedial canthus, which can also be called outer medial or outer Xanthomes or the yellow Xanthos. This plaque is characterized by a small yellow plaque that is visible on the upper eyelids compared to the lower eyelids. Clinically, they are yellowish papules, plaques or nodules, have a soft consistency and can be semi-firm or hard. Apart from the characteristic yellow color, the lesions can be hard, i.e. calcareous, or soft, for example soft. If you want to treat and remove your eyelid xanthomas, investigate Xanthel. It recommended to remove and halt regrowth of eyelid xanthomas. For more details go to xanthelasmatreatment.com or xanthel.com.